IP Psych, these are your Module 69 notes, Part 1. Yes, 1 of 2. These are the somatic symptom and dissociative disorders notes. You'll have one more set after this. So our essential questions: how do psychological issues manifest themselves in our general physical well-being? 2, what does it mean to disassociate? And then 3, why are eating disorders so difficult to treat and recover from? I will say that one kind of will go in our Part 2 notes, will be that last essential question. Our learning targets are focusing on, again, major diagnostic categories. The 2 will be dissociative disorders and the somatic symptom and related disorders. So let's start there, somatic symptom and related disorders. So first, what are they? So this is talking about them in general, and then we'll talk about some specific disorders that fall under this classification. So somatic symptom disorders have an intense focus on physical, meaning bodily. That's what, if you remember from learning about the neuron, we talked about the soma, that main part of the neuron. It's like the body, okay? So focus on physical symptoms, so bodily symptoms that cause distress and dysfunction, where the brain actually produces changes in the body. So you want to think of them kind of as having a placebo effect, where you feel like something is affecting you, but actually isn't, but in a harmful direction, meaning it causes the person distress and anxiety. And then depending on the specific disorder, they may or may not actually have a physical ailment. Okay? Some common bodily complaints include things like muscle and joint pain, insomnia, back pain, headache, chest pain, etc. So let's talk about some individual disorders that fall under this classification. So the first one is kind of named after the classification, so be careful here. So there's the overall kind of umbrella term and then the specific type. So the first is somatic symptom disorder. So this occurs when a person has one or more actual physical symptoms that are unexplained. Sorry about that all. So that it may include things like pain, weakness, nausea, meaning the person is experiencing those physical symptoms, but if a doctor were to run tests and do an exam, we can't find a physical cause for why they feel that way. And then a key thing for somatic symptom disorder is not only that they're experiencing this physical symptom, but it's causing them significant worry about the symptoms, or they have a preoccupation with the symptoms. And that's what makes the difference between like feeling sick to my stomach, having some nausea, and having somatic symptom disorder, is the person becomes, I don't know quite to fixated, but has an intense focus on those symptoms, and it causes them worry and anxiety. That's out of proportion for what it should be for that symptom. Next is conversion disorder, and be careful here because conversion disorder is going to feel similar to somatic symptom disorder. So with conversion disorder, it occurs when mental factors, think of something like anxiety, trauma, stress, actually convert into physical symptoms. So with this, it starts with something in our brain, something in our consciousness and our thoughts, and then it manifests itself into actual physical symptoms. So these symptoms don't fit neurological diseases that could otherwise explain them. So if I were to run tests, if I were to do like an MRI, an fMRI, a PET scan, I wouldn't find actually something going on like in the nervous system, in the brain, for example. Yet the symptoms are real. Like sometimes we can literally see them. So for example, someone might experience paralysis, like have a body part like go numb, or where they can't feel it. They have a loss of sensation, like they all of a sudden can't see, or to say that they can't hear. They might have seizures or uncontrollable uncontrollable motor movements. I'll have you watch some video in class where you have some people with like tremors or facial tics that they don't have control over, and there's no physical cause for it. Okay. And these symptoms often appear after the person has significant stress. So let's see how you do here. So I want you to explain the difference between somatic symptom and then conversion disorders. So go ahead and write. Okay, so again, I know they can be a little bit confusing. So somatic symptom, the person has something physically where they're not feeling well. Let's use nausea. Okay. But there's no reason for, one, we can't find a physical cause for the nausea. And two, the big part is that they become preoccupied, like, why am I feeling sick to my stomach? What does this mean? Okay, that piece. Whereas conversion disorder, we start with the stress and anxiety, and that manifests in a physical symptom. If I'm really upset about something and my feet go numb, I suddenly can't see, that would be conversion disorder. Again, there's no physical cause for why I'm experiencing those symptoms. Next is illness anxiety disorder. So this was formerly known as hypochondriasis. If you've ever heard of someone referred to as a hypochondriac, that would be referring to illness anxiety disorder, is the proper name now. So this is where a person has a preoccupation with becoming seriously ill. Okay, where they're afraid that every little twitch, everything that they experience is a sign of a physical illness. Okay, so it leads a person to seek out medical care, to perform self-exams, to be constantly on Google, look on WebMD, looking up things that might be signs of illness, or they might just constantly live in fear and anxiety of getting sick. Okay. And this may happen without any sort of physical symptoms. The key with illness anxiety is the fear of developing symptoms. So if I'm afraid of developing cancer at some point, and it leads me to constantly seek out medical care, to ask my doctor to run all sorts of tests, etc., that would be illness anxiety disorder. The final grouping we're going to look at in part 1 are the dissociative disorders. So first, what are they in general? So these are disorders in which conscious awareness becomes separated, that's where the disassociation comes in, from the person's previous memories, thoughts, or feelings. There's 3 big categories. We're going to focus on 2 of them. So they include dissociative amnesia, depersonalization disorder, and dissociative identity disorder. That's the one that I'll zero in on the most. A common factor amongst all of them is often trauma from earlier in life. And it's believed that disassociation may be a form of coping with that trauma. So let's look at dissociative identity disorder, or DID. It's often abbreviated. You may have heard of this before. It was previously called multiple personality disorder. So it's defined as a person that exhibits 2 or more distinct and alternating personalities. Okay. This is different from the hallucinations that we talked about with schizophrenia. With schizophrenia, someone may have, say, auditory hallucinations where they hear like voices. In dissociative identity disorder, we have 2 or more distinct personalities. Think of it almost like 2 different people in terms of language, speech, behaviors, etc., in the same body, and they alternate. So sometimes it might be one personality and then a different personality, and there could be many. Okay, and the disruption the person experiences is significant enough to alter their mood, their behavior, their consciousness, their memory, their motor function, their perception. Along with these two or more distinct and alternating personalities, a person has gaps in their memory of typical events, of their personal information, or of traumatic events that are more significant than typical forgetting. Okay. And again, it was formerly called multiple personality disorder. So I'd like you to explain the two symptoms that someone with DID experiences. So go ahead and write. So what you should have written down is this alternating of two or more distinct personalities, as well as significant memory loss that's associated with that. Before I talk about this, let me just say DID is one of the most controversial mental illnesses, and you'll see why when I talk about social factors. Okay? So first, with neurological factors, there's some evidence to show that the brain responds differently to hearing the person's trauma story depending on what personality was in control. So for example, if when having the person like recall or are being told details about a trauma that person themselves experienced, what we see in terms of their brain activity might change depending on what personality is there at the time of the test. It's said that personalities may split in this way as a means to protect the person so that they don't have to relive that trauma. Okay. The problem with this evidence is there's no control group to compare it to. And we also know that hypnosis can alter brain activity. So some researchers think it's almost like a form of self-hypnosis, which is possible. And that's why you don't see the same brain activity amongst different personalities. Some psychological factors. There's a high correlation between someone's ability to get hypnotized and how easily they're able to dissociate. So there's some people that say people that are more susceptible to being hypnotized can enter this like kind of trance-like state and experience depersonalization, meaning kind of feeling separate from your body, separate from yourself. Social factors is the rate at which you hear about other diagnoses. So to give you an example, this was rarely diagnosed until 1976. And what happened in 1976 was a TV movie came out called Sybil. And Sybil, the movie was based on a book written by a therapist. And the therapist supposedly was describing her interactions with a patient that she called Sybil that had dissociative identity disorder. The problem was it came out later that that therapist made it up, that the person actually wasn't experiencing the symptoms of DID in the way that were described in the book and then in the TV movie. So it was possible at that time that other mental health professionals are watching this. It seems super interesting, and they were diagnosing patients with something that they may or may not have necessarily had. And then the last is trauma. Usually you have at least one alter, meaning one of the personalities that report a traumatic experience. And people report that disassociating during that traumatic event helps them cope with what they experienced. For treatment of DID, medication isn't really used to treat symptoms. The research suggests that it isn't helpful. Sometimes a person with DID might be put on medication if they have a comorbid disorder, like if they also have generalized anxiety or major depression. Instead, the focus tends to be on coping and integration, meaning bringing the personalities together. That can be done through behavioral types of practices using learning principles to extinguish the mention of alters, to map out the trauma, meaning to walk someone through the trauma that they experienced. Hypnosis could be as well. The last type that we'll look at is dissociative amnesia. And this is similar to one of the symptoms of DID, where it involves memory loss of personal information, events, or even a portion, I think that should say a portion of time. And it's more than a normal episode of forgetting. This memory loss is more significant or long lasting than just I forgot something. It would be like forgetting a major event, a major chunk of one's life. And the person may not even realize that they experienced that memory loss until maybe someone brings it up to them, and they have no recollection of it at all. So a key difference here with dissociative amnesia is you have that memory loss, but without the different personalities as well. So I have just 2 multiple choice questions for you. So the first one says, number 1, Adela regularly interprets everyday aches and pains, such as stomach cramps and headaches, as serious medical conditions. Her doctor is unable to convince her that her problems are not serious. Adela suffers from what? So go ahead and select your choice. The correct answer is illness anxiety disorder. Next. Last one. Worried that she may hit her father, Maeve finds that her hand has suddenly gone numb. Her most likely diagnosis would be what? Go ahead and choose. The correct answer here is a conversion disorder. That is it for part 1. Make sure you also complete part 2.